Thanks for joining us. I'd like to take just a moment before we kick things off and introduce you to the Haugen Consulting Group. At Haugen, we're driven by collaboration and creativity, and we're passionate about our client relationships and the services we provide. Whether you're looking for a cooperative educational auditing partner, the expertise of a consultant who will roll up their sleeves and create sustainable solutions, or fun and interactive web-based education designed to provide an enjoyable learning experience for you and your staff, Haugen Consulting is always available to help you solve your organization's unique challenges. If you're interested to learn more about Haugen, please visit our website at thehaugengroup.com. Check us out on social media and be sure to subscribe to our blog and YouTube channels to stay up to date. And one final note before we get started, if you have any questions about the CEUs for this webinar and how to access your certificate, we've included a link to our FAQs on the thank you slide at the end of the presentation. And it is my pleasure to introduce today's topic and our presenter. So presenting Coding for Mars, CPT coding for the male genital system. Please help me welcome Christy Pollard. Christy is our Director of Coding, Quality, and Education here at Haugen with years and years of experience and accolades, but I always say it's her true passion for education that I just think is infectious. So without further ado, take it away, Christy.
All right, thank you, Jen. And yeah, the title is a little weird today. We are going to have a little Martian helping us with today's presentation, since it's kind of a Mars and Venus type of a presentation, only we're doing the Mars portion right now. Make sure that you check out our website for the Venus portion, because we can't do one without the other. Today, this is kind of a fundamental type of webinar that goes through the CPT coding for male reproductive procedures. And this is going to be, again, fundamental. So really going back to the CPT book, the structure of the book. We're going to include some anatomy in with this, and then step through the CPT book in the order that these procedures are presented. So the male genital system is the subsection within the surgical section that we'll be discussing today, and this covers codes 54000 to 55899. There are a couple of these procedures that are in the urinary system, particularly when we're looking at prostate procedures, since the prostate can be accessed from the urethra. But these are the general, this is the general structure of this subsection, starting with the penis and then ending with the seminal vesicles. And we are going to start then with the first code block, 54000 to 54450, which covers procedures performed on the penis. So this is the male sex organ that reaches full size during puberty. And there are several different parts on the penis that we want to go over, because anatomy is going to help us with some of these coding for some of these procedures and some of the terminology as well. So the glans is the head of the penis. Let me get my laser pointer here. So the glans, penis. In uncircumcised men, this is covered with pink moist tissue that's called the mucosa. The covering that covers the glans is called the foreskin or the prepuce. And in circumcised men, the foreskin or the prepuce is surgically removed, and the mucosa on the glans then transforms into a dry skin. The corpus cavernosa, if you look at the penis in cross-section, includes 2 columns of tissue running along the sides of the penis, and this is the area that fills with blood and causes erection. The corpus spongiosum is a column of spongy tissue that runs along the front of the penis and ends at the glans, and it fills with blood during an erection, keeping the urethra open. So the urethra runs right through the middle of that. And then, of course, the urethra as well, which is the not only where sperm is released, but also urine. So it is doing double duty as part of the urinary system and as part of the male genital system as well. So procedures that you commonly see in the outpatient setting, and I'm sorry I didn't preface that on the introductory slide, but today, as we talk about fundamentals, we're really going to focus on those procedures that are performed mostly in the outpatient setting. And for the penis, a common-ish procedure that we see is if I can even say it, a preputioplasty. Which is a procedure that is used to release a phimosis. And phimosis is the inability to retract the foreskin. And in the image here, you can see that you've got normal all the way up to a type 4. You can see how tight the opening on the foreskin is in a type 4 that prevents it from being retracted over the glands. There are two CPT codes for this, 54000 for the release in the newborn, and then 5001 except newborn. And this is fairly common in newborn babies and possibly something that you will see in the outpatient setting every once in a while, and probably more common in this day and age than it was 20 years ago. You are probably more likely to see adult men coming in with a phimosis and needing to have that released. The codes for destruction of penile lesions, there are several of them. And typically what we're looking at, in my experience in coding outpatient surgical procedures, the most common lesions treated are penile warts or condyloma. And then they've got, listed out some other common types of lesions that might be treated here as well. And the codes are based on whether it's a simple or an extensive destruction. Extensive would be something that is larger in size, or there are more lesions that require a longer or a more difficult procedural time. And the extensive code, there's only one, 54065. That is by any method. But the simple destruction is divided by the method of destruction as either chemical, so applying some type of a chemical that is going to destroy and break down those lesions, electrodesiccation, cryotherapy, laser surgery, or surgical excision. Electrodesiccation is also called diathermy, and I hope I'm pronouncing that right. Diathermy is a medical and surgical technique where they use heat in part of the body by high frequency electric currents to stimulate circulation, to destroy unhealthy tissue. And so look for these terms in your operative reports when you're coding for a simple destruction. Circumcision, this one is, when I first started coding, circumcisions were usually performed as an inpatient on the birth record, but we're seeing a lot more patients who are coming in as outpatients at a later time. I'm not sure about now. I know at one time there were some state Medicaid programs that would not pay for circumcisions, and the patient may end up coming in at a later time to have that done. Usually when I have seen outpatient circumcisions done, it's usually done on infants, but every once in a while you will get an older child or even an adult male. The type of a circumcision involves removing the foreskin, and your codes are based on the age of the patient and how it was removed. So a lot of times they'll use a clamp or device, and the most common devices that we see out there are Mogan clamps, Gomco clamps, or Plastabels. And you can go out and Google just about any of those and get an image of what that looks like. What these do is they clamp off the blood circulation, and then it prevents blood from flowing into the foreskin, and then it ends up falling off. And they can also do a surgical excision. You see code 54160. That is a surgical excision for not using a clamp or device, and that is divided into neonates and procedures performed on those who are older than 28 days. So they do define what a neonate is in the code description. Code 54162 is lysis or excision of penile post-circumcision adhesions. Every once in a while you do see someone coming in to have these adhesions taken down, and specifically related to the circumcision, and that gets reported again with 54162. And if there was incomplete circumcision and they need to repair that, we have code 54163. My computer's not responding. There we go. Okay, chordee and hypospadias. So we'll start with hypospadias, which is a congenital condition. This is something that baby boys are born with, where the urethra does not properly develop on the tip of the penis. So rather than being at the tip, you have it on the undersurface of the penis, and there are different levels of this. So subcoronal is going to be, pretty close to the glands, but still not on the very tip. Penoscrotal, where the penis meets the scrotum, and then scrotal. The urethra, again, is where your urine gets expelled. So they're going to want to replace this or repair this. Hypospadias is often associated with a chordee, which is an abnormal curvature of the penis. So let's start with chordee repair. This is the most simple. So chordee may be performed with or without mobilization of the urethra, and that kind of depends on if there's going to be a hypospadias repair. Sometimes they don't do sometimes the penis is bent, and then just by repairing that, they are able to correct the hypospadias. But if they have to mobilize the urethra, if it is really truly on the undersurface of the penis instead of coming out at the very tip, then they'll have to mobilize that and move it towards toward the tip. That would also be a stage 1 hypospadias repair. And then they bring the patient back at a later time to do a stage 2 and possibly a stage 3 hypospadias repair. So this slide shows the stage 2 and 3 hypospadias repairs, and codes 54308 and 54312 are for urethroplasty for a second stage hypospadias repair, and these codes are differentiated based on whether it was less than 3 centimeters or 3 centimeters or more than 3 centimeters, and the source of the tissue that they're using to construct the urethra is the foreskin. And a lot of times for these babies who are born with a hypospadias, they will not circumcise them right away so that they can use that foreskin as part of the repair in formulating this new urethra, because they're usually having to add on to it. You can imagine that if it's a penoscrotal repair, that it's going to be more than 3 centimeters, and so that might be a 54312. Now, if for some reason they don't have the foreskin available, or they've determined that they're not going to use that, they need to use a free skin graft, then that code is reported with, or that procedure is reported with 54316. And that free skin graft is coming from a different site in the body. And then if there's a stage 3 repair, this would be for a pretty severe defect where they release the penis from the scrotum. This is called a cecil repair. So stage 3, 54318.
Hey, Christy, I'm going to hop in here with a little question for you. So, with everything that's been done in the way of medical and surgical advances, can hypospadias repair ever be done in a single procedure, or is it always a staged repair?
And great question. And yes, it can be done in a single stage. And there are some codes for that. So let's fast forward and talk about one stage hypospadias repair. And this is probably more common. There are more codes, as you can see. So we've got codes 54322, 54324, and 54326, which are all for distal hypospadias repair. And this includes chordee repair if performed, as well as circumcision if it's performed. So you would not be coding those separately. They have different types of advancement. So 54322 is a simple meatal advancement. The urethral meatus is that opening, where that opening is coming out of the penis. This may also be called the magpie or a V-flap procedure. If they use local skin flaps, it's 54324. And if they use local skin flaps and mobilize the urethra, it's 54326. And actually 54328 should be indented here. So I will get this corrected before you see this in your handouts. And this is extensive dissection to correct the chordee with urethroplasty and local skin flaps, skin graft patch, and or an island flap. So you can see that we're going from kind of very simple one-stage repair in 54322 all the way up to this more extensive procedure where we're using free skin grafts or island flaps with 54328. Code 54332 sorry, getting my bearings here for a minute. I was talking really fast and that's a lot of numbers. 54332 is a one-stage proximal penile or penoscrotal hypospadias repair requiring extensive dissection to correct the chordee and urethroplasty using a skin graft tube and or island flap. Remember, hypospadias at the penoscrotal or the penile level is going to mean that we're going to have to create some urethra because we've got such a big gap there. And again, this is one stage. So we talked about the codes previously that had the less than 3 centimeters and more than 3 centimeters. Well, would be all done in, those were staged. This is all done in one. And then finally 54336, which is a one-stage perineal hypospadias repair. And the perineum being the skin that is located between the scrotum and the anus. So that's going to be a very a hypospadias that's very close to the body. There's going to be a lot of urethra that needs to be recreated there. So again, a very extensive procedure. So looking at some case documentation, and this is a complete op report. I may have cut out like the last paragraph or something that talks about closure, but this is a 6-month-old boy with a coronal hypospadias with chordee. And coronal, it's located towards the tip, it's close to the glands. And they're going to do a hypospadias repair, which he calls a urethroplasty plate incision with tissue flap relocation and chordee release. This slide just gives us kind of the introduction of what's happening and what they're going to be doing, and then the procedural prep. On the next slide, I have highlighted out the portions of this procedure that are going to be what we're going to focus on. So they talk about the chordee tissue being removed and dissected up towards the urethral plate to use as secondary tissue flap coverage. So that we're removing some chordee tissue. And then they marked out the transurethral incision plate with demarcation for the glands and the ventral midline of the plate. There's a blank in this operative report. This excerpt was taken from a website called mtsamples.com, which is just transcribed medical reports. So there was a hole in their documentation that did not get plugged before it got uploaded. On the next slide, they talk about that urethral plate being rolled using subcutaneous closure, and there were 2 areas of coverage with the tissue flap relocation from the glandular wings. The tissue flap that was rolled with the Byers flap was used to cover this, as well as the chordee tissue. So what we're looking at here is a 1-stage hypospadias repair with urethroplasty. That urethral plate that they were talking about is our urethroplasty, and it gets assigned code 54324. Again, the rationale here is the urethroplasty plate incision, which is also known as a tubular incision plate urethroplasty, or TIPU, where the urethral plate was fashioned into a tubular urethra. There is no documentation here that the urethra was mobilized, and again, we're not going to be assigning a code for chordee repair because it is bundled. Epispadias is kind of like hypospadias, but hypo means under or below. That's where the urethra is exiting on the undersurface of the penis. An epi means above or on top of, so an epispadias is a congenital anomaly where the opening of the urethra has formed on the top of the penis or on the side of the penis rather than on the tip. So we've got code 54380 for epispadias correction, and this is just a simple surgical correction of the epispadias. 54385 is where you have epispadias complicated by absence of a bladder neck and sphincter, and therefore the patient is incontinent. So if you recall back to urinary anatomy, you have 2 urinary sphincters that allow you to voluntarily void or hold your urine. And with that, with code 54385, not only are they doing the epispadias correction, but then they are also correcting this incontinence. And then 54390 is assigned when they do an epispadias correction with correction of bladder exstrophy. And bladder exstrophy is a condition where the bladder is turned inside out and it protrudes through the abdominal wall. So we're going from a very simple epispadias repair in 54380 to a very complex epispadias plus something else going on in a 54390. Moving on to procedures on the testis or the testicles. The testes are paired oval-shaped male reproductive organs that are suspended in a pouch of loose skin called the scrotum. Within the testicles are a lot of different structures, and there are different sections in CPT for procedures performed on these different parts. So if we're looking at the actual testis, which is where sperm is produced and stored, then you have the epididymis, and that is this coiled tube here that we've got the tail, the head, and then the body of the epididymis. It's a narrow, tightly coiled tube that connects the testicles to the vas deferens, which is also known as the ductus deferens, and that's how it's labeled in this picture. The epididymis, again, has those 3 parts that we noted, the tail, the body, the head, the body, and then the tail. And the rete testis, I don't know if I'm pronouncing that right, is a network like structure that's made with tubules, and it's situated where all of the seminiferous tubules are connected to each other. And You may also hear reference to the testicular layers. So we've got the tunica vaginalis, which is further subdivided into the parietal and visceral layers. You also have, and which is not labeled in here, the tunica albuginea, the middle layer of the testis, and the tunica vasculosa, the innermost layer of the testis. When it comes to CPT coding, what we will focus on are, there are sections of codes for the testis, there's a section of codes for the vas deferens or the ductus deferens, for the epididymis, and for the tunica vaginalis. I think I captured all of those. So just know that if you're looking for a procedure and you're looking under this code block, if it's a procedure on the epididymis, it's probably not going to be here. It's probably going to be under the epididymis section or one of the other sections if it's done on the tunica or something else. Testicular biopsy is fairly common, and this is performed to evaluate lumps and bumps and rule out testicular cancer. So code 54500 is the code for a needle core biopsy, but I do want to give a shout out here that if they do a fine needle biopsy, that gets reported with the codes. They look like they're from the integumentary systems section, the 10004 and all of those different codes. It's kind of a weird code range because it's got out of order codes in it. But this is actually just general codes before the integumentary system. FNA can be performed on pretty much any part of the body. So there is a difference. If FNA is done through a smaller needle, they are aspirating some cells that goes to cytology, whereas needle core biopsy actually takes a core of tissue that it's a hollow needle that pulls out of core of tissue that goes for pathological examination. And then there's incisional biopsy, which would be putting the patient under general anesthesia and making an incision into the testicle to take a sample of that tumor. When the note that we have in the teal box at the bottom here just mentions that when fine needle aspiration is performed with a needle core biopsy on the same lesion, you would only code the needle core biopsy, and that is per NCCI edits, per the NCCI manual. The CPT code book does suggest that you can code both if both a core biopsy and an FNA are done on the same lesion, but NCCI says you cannot. So our recommendation is to follow the NCCI guidelines. Orchiectomy, orchi refers to, or kiddo, I think is the technical medical prefix. It refers to the testicle. So anytime you see a procedure that's orchi anything, it is referring to the testicles. Orchiectomy is removal of the testicle, and this is usually done for cancer or for some type of, potentially some type of injury or rupture. Code 54520 is for a simple approach. If they only remove a portion of it, so let's say the patient has a mass and they remove part of the testicle with the mass, but they don't remove the entire thing, then you would assign code 54522. 54530 is radical orchiectomy via an inguinal approach, and that is done for tumor. Code 54535 is radical for tumor, and that's with abdominal exploration. And then they could also do an orchiectomy through a laparoscope, which is code 54690. So a couple things to point out here. Notice that the laparoscopic code is in a different area of the CPT book than the other ones. The other thing to note, and I know I don't have the full code descriptions here, refer to your CPT book for the full code descriptions, but 54520, the 22, the 30, and the 35, None of those actually say open in the code description, but they are all open procedures. So if you're coding for a laparoscopic orchiectomy, your code is going to be a 54690. Repair of a testicular torsion. Testicular torsion occurs when the testicle twists spontaneously on the spermatic cord. It's extremely painful, and it is a medical emergency because that spermatic cord has the blood supply, and if it's not treated immediately, then you're not getting blood to the testicle, and the testicle can die. So this can lead to venous occlusion and engorgement, arterial ischemia, and again, that infarction or that killing of the testicle. Surgical reduction of a twisted testicle or a testicular torsion is 54600. And sometimes when they do this procedure, they do fixation of the opposite testicle just to make sure that it doesn't occur there. And that is reported with code 54620.
All right, Christy, I've got another question. So I've heard the term orchiopexy. So is that the procedure that's used to describe a repair of a testicular torsion that you were just talking about?
You know, you would think so, because pexy usually means fixation or putting in place, and it seems like that contralateral fixation or that torsion with fixation would fall into that, but the answer is no. An orchiopexy is a surgical treatment for an undescended testicle, and that's what we're going to talk about next. So when males are born, the testicles are located up in the inguinal area or in the abdomen, and then they drop into the scrotum as the child matures, but that doesn't always happen. So when they are concerned about the fact that the testicles have not dropped, and this is a condition called cryptorchidism, which is failure of one or both testicles to descend from the abdomen down into the scrotum. So we have codes for exploration of an undescended testis, 54550 if all they did was the exploration. If they did abdominal exploration along with that, it's 54560. Orchiopexy, which is the actual, pulling the testicle down into the scrotum and then fixing it inside the scrotum so that it doesn't retract back up, is 54640 from an inguinal or a scrotal approach, and 54650 for an abdominal approach. And then if they do it laparoscopically, it's 54692. The epididymis codes 54700 to 54901. Again, the epididymis is that tightly coiled, elongated canal that connects or conducts sperm from the testicles to the vas deferens. If you were to remove the epididymis and stretch it out, its length would reach up to about 20 feet. So it doesn't look that big, but it is coiled around inside the scrotum, and it's very long. It's a long distance for sperm to travel. So biopsy and excision of epididymis. Epididymitis is pretty common, and you may see men who are being admitted with procedures to either remove a segment of epididymis or take a biopsy of it. So an epidydymectomy is the surgical removal of the epididymis. And I think it's worth noting here that, in addition to the codes that we have, so we have 54800 for biopsy, 54830 for excision of a local lesion, 54840 for excision of a spermatocele, and we're going to talk more about spermatoceles coming up in a little bit, with or without an epidydymectomy, and then just a straight up epidydymectomy. all of the codes until you get to the epididymectomy codes are unilateral codes. So modifiers RT, LT, and 50 apply if they did it on one side or both sides. Once you get to code 54860, that code specifies unilateral. So you could report an RT or an LT modifier to be specific, but you would never report a 50 modifier. And then for bilateral 54861, you would never report any modifiers with that code because it says that both testicles were done. Moving on to, we're going to cover several CPT sections here. And I see that I don't have my full code range on here, so I will fix that before you see this presentation. But the tunica vaginalis, it begins with code 55000. There are a handful of codes there. We're also within the section are procedures on the scrotum, on the vas deferens, and the spermatic cord. And again, that tunica vaginalis is that outer layer of the scrotum. It's actually composed of from the abdominal peritoneum. It continues through the inguinal canal to line the interior of the scrotum and envelops the testicle and all of its ducts in the spermatic cord. The scrotum is that thin external sac containing the testicles that helps to protect them. And the vas deferens is the tube that carries the sperm from the testicles to the urethra, also known and labeled in this image as the ductus deferens. The spermatic cord, so you see the ductus deferens, you see all of these blood vessels. The spermatic cord is the cord-like structure traveling through the inguinal canal to the testicles that contains both blood vessels and the vas deferens. And this is what, in a torsion, this is what gets twisted and cuts off blood supply. So starting with hydrocele procedures, a hydrocele is a collection of serous fluid which can develop in the tunica vaginalis or the spermatic cord. And when they do a hydrocelectomy where they go in to remove it, you're going to need to pay attention to where that hydrocele is located. So watch your coding terminology. Was it a hydrocele of the tunica vaginalis or of the spermatic cord? And they're in two different areas of the CPT book. So for the tunica vaginalis, they can do a puncture aspiration of a hydrocele, but probably more common is going to be a hydrocelectomy, which we have codes for unilateral and bilateral. Again, no 50 modifiers here. If you're reporting a 55040, you could do an LT or RT to show which side was performed. But then you'll notice the spermatic cord hydrocelectomy is a unilateral procedure. And in this one, if they did do both sides, then a modifier 50 would apply. You'll also notice that this is designated as a separate procedure. So this is commonly bundled with other procedures when performed at the same time. Vasectomy is probably a procedure that most people have heard of. It is the procedure performed for male sterilization, and it is performed by ligating the vas deferens so that sperm cannot make it from the testicle through to the urethra. Vasectomies are, they perform them now with simple keyhole procedures that can be done in a physician's office. So you don't see as many in the hospital setting anymore, but a lot of times you will see one performed with another procedure, or you may see a patient coming in for a vasovasostomy, also known as a vasorrhaphy, which is a vasectomy reversal procedure. And I'm not sure how many of those are done anymore. I don't know how effective they are, and you know, I don't know with scar tissue. I've heard of several vasectomies failing, but for the reversal, I don't know how well that works. I can tell you how to code it though. Looking at our next case study. So this is a patient who is coming in with a left spermatocele, and he's going to have a spermatocelectomy and an epididymectomy. And while they're at it, this patient desires sterilization, so they will also do a bilateral partial vasectomy. And again, we're just going to concentrate today on the highlighted portions of this operative report. This patient has a large spermatocele, and they went in and dissected the tissue around it and noted its significant size. It also included the entire left epididymis. So they decided to do a spermatocelectomy and a left epididymectomy to remove all of the affected area. So this slide is describing the removal of the epididymis, which also is removing that spermatocele. On the next slide, they are doing the vasectomy. And this is the vas deferens was palpated and dissected free. Approximately 1 centimeter segment of cord was removed. And then they did electrocautery. Then they turned to the right side and did the same procedure. So they not only ligated, but they also coagulated the ends of the vas deferens with electrocautery. So we've got code 54840LT for excision of the spermatocele with or without an epididymectomy, and this was only performed on the left side. So the LT modifier is showing us that it was unilateral. Code 55250 is the vasectomy, and that is a unilateral or bilateral procedure as noted in the code description, so no modifiers for laterality there. Varicocelectomy. So varicoceles, we've got spermatoceles, hydroceles, and varicoceles. And varicoceles are enlargements or varicosities, so varicose veins that occur in the veins that drain the testicles. So it's kind of like hemorrhoids in the testicles, or varicose veins of the testicles. This causes pain and testicular atrophy, and they can impact male fertility as well because of the decreased circulation of blood to the testicles. A lot of these cases are diagnosed during an infertility workup, and the treatment is a varicocelectomy, where they go in to tie off the affected spermatic veins. So we have codes 55530 for excision of the varicocele or ligation of the spermatic veins to treat the varicocele. 55535 is that same procedure from an abdominal approach. 55540, same procedure with a hernia repair. And then 55550 is the code for laparoscopic ligation of the spermatic cord or spermatic veins for a varicocele. Moving on to the seminal vesicles and the prostate. The prostate, we're combining two different sections here. There is a section or a subsection or a category, I don't know what CPT calls it, but within the surgical section, within the subsection of male genital system, we've got this header for the seminal vesicles and then another one for prostate. The seminal vesicles are paired glands opening into the vas deferens near its junction with the urethra, and they secrete components of semen. The prostate is a walnut-sized gland that lies at the base of the bladder, and it is responsible for producing seminal fluid that nourishes and transports sperm. So both the seminal vesicles and the prostate aid in semen production and in movement of sperm. The prostate is probably one that we hear of quite frequently. I think it's estimated that like 90% of men over a certain age have some type of prostate hypertrophy. which, because this gland surrounds the urethra and wraps around it, has a tendency to constrict the urethra, which can make it very difficult for a man to void. And so a lot of the procedures we will see here relate to prostate biopsies and removal of tissue. So biopsy of the prostate can be done either through a needle, through fine needle aspiration. We've already addressed the fine needle aspiration codes before. We've got the several codes for fine needle aspiration, which depend on the type of imaging guidance that is used and how many lesions are biopsied. Code 55700 is your code for a core needle biopsy of the prostate. 55700 is an incisional, and then 55706 is transperineal sampling of tissue using stereotactic template. And this is a template that goes, it has holes in it, it goes on the perineum, and then using stereotactic guidance, they are able to advance the needle into the prostatic tissue and get a sample. Prostatectomy can be performed for patients who either have prostate cancer or who have an enlarged prostate and they need to remove it. There are transurethral prostatectomy and destruction codes that are found in the urinary system. So it's important to understand that not all of your prostate removal codes are going to be found in the male genital system. Some of them will be in the urinary subsection when they are approaching the site from the urethra. Open and laparoscopic prostatectomy codes are found in the male genital subsection. And then open prostate procedures are going to be on the inpatient only list if you're coding in the facility setting.
Hey, Chrissy, one more question for me. So I've heard there's a new code, 55867, for laparoscopic simple subtotal prostatectomy. So can you tell us a little bit more about that code?
Yeah, so this code was introduced for 2023. And as you mentioned, it's for a laparoscopic simple subtotal prostatectomy. And the full code description tells you everything that gets bundled into that. So there are two codes for laparoscopic prostatectomy. And prior to 2023, we only had one code, 55866, for a retropubic radical prostatectomy done via laparoscopy. But now we have this new code for simple subtotal. And as I mentioned, there's a lot of stuff that gets bundled here. So these are often performed using robotic assistance, and that is included in the procedure. It's not anything that gets coded separately. But for the simple subtotal, it also includes control of post-op bleeding, vasectomy, meatotomy, urethral calibration and or dilation, and an internal urethrotomy. So make sure you're reading your full code descriptions and also checking NCCI edits to make sure that you're not unbundling those services. TURP, transurethral resection of the prostate, and these are the codes that you're going to find in the urinary system portion of the surgical CPT book rather than in the male genital. Also known as TURP, this is where they go in with a resectoscope through the urethra and remove the prostatic tissue that way. So 52601 is your code for TURP. Sometimes the tissue grows back and they have to come back for a repeat TURP. That would be reported with code 52630. And then if they do a TURP, but also are treating a postoperative bladder neck contracture, that's a 52640. Other transurethral prostate procedures that you might see: laser coagulation of the prostate, laser vaporization of the prostate, and laser enucleation with morcellation of the prostate. When all of these codes include, these are, again, on this slide, I'm not giving you the full code description because you've got code books, But all of these codes include control of post-op bleeding, vasectomy, meatotomy, cystourethropy. That's something that they almost always do at the end of these procedures is a cystoscopy to make sure that they didn't puncture the bladder. That's bundled. Also includes urethral calibration and or dilation, internal urethrotomy, and TURP, except for code 54647. The last procedure that I want to talk about today is prostate brachytherapy. And this is the transperineal placement of needles or catheters into the prostate so that we can deliver radioactive elements or brachytherapy into the prostatic tissue. This works very similar. You get a template, kind of like for the prostate biopsy we were talking about earlier. The template gets put on the perineum, and then they advance a series of hollow needles through the template, and then they load the radioactive elements or seeds through that hollow needle. And as they pull back, it leaves all these radioactive seeds into the prostate, which will destroy that prostatic tissue. This code 55875 is the code for the surgical placement of those radioactive elements. If you're coding in the hospital, then the charge master usually is going to pick up the radiation therapy codes that would go along with this to show that the radiation therapy was delivered. And that is going to wrap it up for male genital procedures. These are the sources that I used for today's presentation. If you have any questions about today's presentation, go ahead and shoot me an email at hahelp@thehaugengroup.com. And Jen is going to give you some important information about obtaining your CEUs. Jen?
Thanks, Christy, and thank you so much. What a great presentation, so much information. I always like to remind folks that immediately following the webinar, a brief survey does appear on your screen. And if you can, please take a couple minutes to complete it. We are always looking for your feedback on what you liked and didn't like. And remember that we develop new training based on that feedback. And then, as Christy said, a reminder that if you have questions on your CEUs or your certificate, we've tried to make it even easier. On this slide here, you'll see a link to our FAQs. That goes to our FAQ page on our website. And there's a lot of helpful hints there for navigating the webinars, including how to access your certificate. So encourage everybody to bookmark that. As Christy said, if you have questions, please reach out to us at that hahelp@thehaugengroup.com. We always post those Q&As from webinars when we receive them. And I always love to remind folks that if you subscribe to our blog, you will not miss a Q&A. Encourage everybody to check out our upcoming webinars on our calendar. I want to thank you all for joining us. Thank you, Christy, and we hope to see you all next time.